Welcome back, my friends, to our fourth lecture with PTCB firstpass.com. We can continue what we finished last time. Last time we stopped at the drug-nutrient interactions, and we were talking about the different kind of interactions that can happen between the drug. We started by drug-drug interactions, then we went to drug-nutrient interactions, and right now we're going to continue with the drug-herbal interactions. So drug-herbal and supplements can really interact with a lot of medications, which can actually affect the medications that we are treating with the patients. So it can either increase or decrease its efficacy, and we're going to look at some examples that are well known for you to review. For one of the most famous ones from the herbal or supplements is ginkgo biloba. So ginkgo biloba supplement is available over the counter, and it increases the risk of bleeding. That means if you are taking medications like non-steroidal anti-inflammatory, warfarin or clopidogrel, they can cause bleeding, because this effect, if not taken into consideration, in addition to the effect of those drugs, then the blood will be, in addition to those blood thinners and anticoagulants that the patient is taking, that can cause a highly increased anticoagulation effect or higher blood thinning effect, which can lead to internal bleeds, external bleeds. All types of bleeds are actually dangerous. So they don't only interact with, this is just an example, they actually interact with a lot of other medications other than blood thinners and antiplatelets, but this is one of the most famous ones. And that's why it's important that anyone who is on those blood thinners need to ask the physician and the pharmacist about what kind of over-counter medications they can use and which they can't use. The second example is a very common medication that is used as a treatment, or I would say a supplement for antidepressant, is St. John's wort, and it's over the counter too. It's used to treat depression, and what it can do is that if someone is taking an antidepressant like SSRI or SNRIs or tricyclic antidepressants or any other depressant, that can cause a higher level of serotonin than it should be, and it can cause serotonin syndrome. Serotonin syndrome is basically it's a medical emergency, kind of like diagnosed with what the patient has been taking, high fever and temperature, in addition to other side effects that you have to rush the patient to the hospital to take care of it. St. John's wort also affects a lot of other medications, including HIV medications. So they can either increase or decrease the efficacy of HIV medications. So, and we know that HIV patients need to have their viral load under control. So if the viral load the viral load increases, we have to adjust the doses when the patient is taken, and if really increases higher, the medication concentration increases so high in the blood, can cause really serious side effects. So it's not good for the medication to be high, not to be low, and as we discussed before, our objective is those for the medications concentration in the blood to be within the maximum effective dose and the least effective dose. Other type of interactions with drugs includes drug-alcohol interactions too. Those are kind of very famous. With a very well-known example is with metronidazole, and metronidazole is an antibiotic or anti-infective. It's used to treat anaerobic bacterial infection. It's also used to treat some kind of protozoas that are infectious, that can infect our intestines and can cause dysentery. So when someone takes an flagyl or metronidazole with alcohol, it causes something called disulfiram-like reaction. This sulfiram-like reaction will actually cause severe vomiting and stomach ache. Disulfiram actually itself is one of the medications that is available in the pharmacy shelves to treat alcoholism, and basically patients who are being treated from alcoholism, they take this medication in order for them to keep them away from alcohol. So if they think about craving and they want to drink alcohol, it will make them feel so sick and so bad. So that kind of like causes negative impulses whenever they are trying to think about craving for alcohol. So whenever we dispense as a pharmacist and also as our technicians, the labels show on those metronidazole, don't take with alcohol. And we have to make sure that our patients understand that, so because it's a really severe side effect. Another example is with opioid analgesics. So alcohol is a depressant. That means it lowers our activity down. It's it kind of like anti-anxiolytic, which is not true. It's anti-anxiolytic in the beginning, and later on, as more of it is being used by the individual, it causes anxiety. So kind of a complicated alcohol effect in the body. So because it's the first thing that it does is basically as an anti-anxiety and it depresses the whole organs, making things like slow down. People feel sleepy, people feel drowsy, and then if they also take an opioid analgesics, that will be an additive effect, because opioid analgesics too does the same thing. So double or more actually effect on the sedation, and this can cause to excessive sedation, can cause respiratory depression, which is basically a person stop breathing, can cause coma or death. So we have to be very careful when we are dispensing any of those opioid analgesics, any of those benzodiazepines and sleeping pills, not to be taken with alcohol, because alcohol can increase their effect and make it actually can cause the side effects that we talked about: excessive sedation, respiratory depression, coma, or death. The last one we're going to talk about today is the drug laboratory interactions, which basically medications that can interfere with laboratory tests and cause changes in the results. So a very common example is basically we'll talk about it is thiazide diuretics and loop diuretics. They cause elevated HDL cholesterol in the blood. Barbiturates, thiazide diuretics, corticosteroids, and oral contraceptive can also increase the blood glucose levels. Beta blockers, aspirin, and trimethoprim, sulfamethoxazole can decrease sugar blood levels too. Thiazide diuretics, it seems like thiazide diuretics is always having something to do with the labs. And angiotensin converting enzyme inhibitors, which are ACE inhibitors, NSAIDs, and caffeine can also cause hypokalemia, which is low potassium level in the blood. So how does the thiazide diuretics and loop diuretics increase the thiazide and decrease the potassium level in the blood? They do that because we know diuretics, they actually increase the urine information, and what they do is, so they increase diuresis. Increase urine information is diuresis, and when they do that, they're also taking potassium out in urine too from the blood. So as it falls into its action by causing diuresis, it also does not only remove extra fluid, but it also removes it removes potassium from the blood. So we're going to start with another section, and please, if you have any questions, just make sure to send me an email or just communicate with me through the website or through the YouTube, my YouTube channel, so I can answer any questions that you have about what we have discussed today. Today we're going to also start talking about the cardiovascular medications. But before we start on the cardiovascular medications, I would like to also talk about the brand names and generic names. Drugs have three types of names. Medications have three types of names. It has the chemical name, it has the brand name, which is the company brand name, proprietary name, and a generic or non-proprietary name. The brand name, as you know, is the actually name or the brand that's assigned to the drug by the manufacturer, the original manufacturer of that drug, and who also developed it. And the patency, they have a patency protection for approximately 20 years. So from the time the patent application, or from the date the patent application is being submitted. Generic names, those are the names that are non-proprietary, and after the patency of a brand name drug expires, other drug manufacturers are allowed to produce the same generic version of that drug, often with a lower price. Some crazy stuff happen right now where you can see sometimes the generic is so high, basically very similar to the brand. That usually happens at the beginning when they get launched, and then by time, as competition increases with so many generics in the market, that can lead to actually to lowering the price. The brand names and the original company, they have to prove a lot and provide a lot of information to the FDA in order for the drug to be approved. They have to provide phase 1, phase 2, and phase 3 results, which is basically phase 1 is studies that are done on animals, phase 2 is studies done on healthy individuals, and phase 3 is a kind of a smaller scale of treating specific patients versus placebo. The generic name drugs companies, they're not required to do all this. Only one thing they have to prove is that both the generic and the brand name are bioequivalent. And we said what's meaning bioequivalent is by knowing that bioequivalent is how much of the percentage of the blood of the medication reaches the blood. So if I take 100 milligrams, I think we discussed that before. If we take 100 milligrams of any medication by mouth or per rectum or any other route other than IV, because IV we know it's 100% bioavailable. If I give 100 milligrams, 100 milligrams for sure is going to reach the blood because I'm injecting directly into the blood. Other routes of administration, they depend. And so if I took orally by mouth 100 milligrams of any medication, and then after that I measure after a specific amount of time, and this differs between one medication to another, we call it the peak time of that medication. If we actually measure it, it should be similar, at least 80% equal to the brand name. So if the brand name is 80% equivalent, bioequivalent, that means 80% of the dose that I took is available in the blood, then the generic name need to prove that there is bioequivalent to the brand name 80% or within 20% of what the brand name is. So either 20% plus or minus, that's the allowable difference. Otherwise, it's not going to be approved. And if you have any more questions, please let me know, as I said. And then we're going to go quickly to different names of medications. We know that antibiotics, usually the brand name, for example, amoxicillin, and the brand name is amoxicillin. Glucophage is the brand, metformin is the generic name, Lexapro is the brand, escitalopram is the generic, Lipitor is the brand, atorvastatin is the generic, and so on and so forth. One last thing for today is basically we're going to talk about how are the medical terminologies and pharmacological terms are built. Usually, there is 3 parts of every medical word or pharmacological terminology. There is a root of the terminology. There is a prefix which comes before the root. That comes before the root. There is a suffix which comes after the root. So, for example, if we talk about the terminology pericarditis, it is, if we can split it, peri is the suffix and it means surrounding, card means heart, which is the root, and itis means inflammation. So basically it means inflammation surrounding the heart. Most common roots that you should be familiar with too is like cardio, as we said, stands for heart, carcino stands for cancer, cyto stands for cell, entero stands for intestine, derma stands for skin, gastro for stomach, pharynx for pharynx, pharynx on throat or throat, ab means away from, ad means the words, bi means both, epi means upon, macro means large, I think this is easy, micro means small, pre means before, and post means after. So, and the common suffixes are itis, which means inflammation, lysis means breakdown, partum means birth, pathy means disease, otomy to cut into, scopy means visual examination. So we're going to stop here today, and next time we're going to start talking and getting into each of the human systems and what medications they affect. So we're going to know the medications through the systems that they affect. So we're going to start with cardiovascular system, and then we go on and go forth until we finish all the systems that those medications work on. Thank you very much for following up, and please don't forget to subscribe and like, and join me on my channel too if you have any questions or if you need extra help. I'm available, and I'll be more than happy to help you with whatever you need to in order for you to be able to pass the test. Thank you.